We welcome now Dr. Katherine Pannel, Right Track Medical Group, and also are you the Mississippi Psychiatric Association chairwoman, I understand. Is that right, Dr. Pannel?
President-elect.
Oh, awesome. Congratulations. That's fantastic.
Thank you.
May,
Thank you.
Yeah, May is Mental Health Awareness Month, something we need to be certainly cognizant of. How are we doing in our state? How does our state sort of rate versus the other states with respect to just the occurrence of mental illness?
I'm really, really proud of Mississippi. For the last 2 years, the legislature has really done a lot of powerful work that has been really efficacious in improving mental health in Mississippi.
Okay, so we're improving. And is there any particular action that we're taking? Your organization, for example, other healthcare providers, perhaps in advances in medical treatments that are causing us to improve our situation there?
Sure. I know one of the most important things that I found out yesterday was that for the second year in a row, Mississippi's opioid-related overdose deaths and overdoses has decreased for the second year in a row. And I think that has a lot to do with the legislation that's been passed for the past 2 years for harm reduction. Okay.
Yeah. And, in fact, I just received a text on our text line informing us of that improvement in terms of opioid deaths. I mean, this is a scourge that has kind of gripped the entire country now for the last few years, is it not?
It has. I mean, we're not only in a mental health crisis, but we're also in an overdose crisis, and we're seeing overdose deaths increase in a large part of the country. But I think that's something that Mississippi can be proud of and celebrate is that, again, for the second year in a row, we're actually seeing a decrease.
And are most of the times, is this accidental or intentional? I mean, is this a person who seeks to end their life, or do they just do it inadvertently?
No, both scenarios are sad, but what we're seeing right now is this is a lot of our young adults. These are kids in college. These are kids recently getting out of college that are choosing to cope, unfortunately, quick fix, reaching out for a pill that they have no idea has been laced with something dangerous like fentanyl or xylazine. And sadly, they're losing their life after just one use.
Well, just thinking about how unfortunately widespread this issue is, I think virtually every one of us knows somebody who is either themselves lost their lives to this or they're a member of a family that you know. I mean, I can think of a few right now, sadly, that I know. And there's the same situation you were talking about, young adults, college age, right out of college, same situation. I know their parents, for example.
Right. I mean, if we don't know somebody personally, we've heard a story, we've seen it on the media, or we know someone who has lost a loved one. I mean, it is really, unfortunately, a crisis in our country right now.
What other legislation do you feel like we need, Dr. Pannel, to keep addressing this serious issue?
So we've already started the groundwork. We've had great legislation. Last year, fentanyl testing strips got decriminalized, so we now can get fentanyl testing strips in the hands of these people to test the substances to see if they have been laced, which is great. We know harm reduction works. We've made it now that naloxone is available to be assessed by anybody in the general population. There's basically a standing order from the Department of Health. You can go into a pharmacy and get it. You can go online to the Department of Health and request it and get it in the mail confidentially and free. But even this session, we've expounded upon that. We've now made it so that community organizations can now access naloxone harm reduction, and they can distribute it in mass, which we know that the more naloxone in hands means the more lives saved.
What do you think about, because it seems to be so related to mental health, that just what appears to be a fairly broad move in the country to ultimately authorize medical marijuana, and then really more recently, I guess we're seeing more states enact and make it lawful to use and distribute recreational marijuana. In the state of Mississippi, of course, medical only. You've shared some concerns before about how that affects the mental health of our population, have you not?
Sure, I know, and I know sometimes my concerns are not always the popular concerns, but I
Sure.
really do like to look out for the well-being of my patients, and I'm a big proponent of evidence-based medicine. And there's just not studies on marijuana. We just don't know how it works as a medication because we've not been allowed to study it at this point. I know that legislation is being tossed around about making it more accessible to be able to study, which is great. So, I mean, at this point, I wouldn't prescribe it or certify for it because it's not evidence based. But what I can say about, regular marijuana, on the street marijuana, it is not the marijuana that we knew 20 years ago. It is so much more potent, and we are seeing that it can lead to increased rates of suicide, increased rates of psychosis. So we do know that marijuana that we're seeing on the streets right now is not safe.
Okay. So, well, since we have legalized medical marijuana for medical use here in the state of Mississippi, have you seen an uptick in mental illness as a direct result of that you could point to?
No, I have not personally in my clinics, no. But at this point, I'm not willing to certify for it. I do want to see those studies, those long-term studies, to make sure that this is not like another. We thought opioids were safe in the beginning too, and now we're looking many years ahead and saying maybe they weren't the best thing to treat pain for, with. So I want to
Yeah.
make sure that if we're treating, psychiatric illness with marijuana, that in the end it's going to be safe. In my personal opinion, I feel like it's a temporary fix. Of course, you're going to feel good acutely, that you're going to have that high, that increase in dopamine. You're going to feel better. But long term, is it really the fix that we're looking for? When we can implement healthier strategies to really combat depression and anxiety.
It being Mental Health Awareness Month, what sort of things should people be on the lookout for if they feel like that maybe someone in their orbit is experiencing or exhibiting signs of mental illness? What are the warning signs?
Every year Mental Health Awareness Month has, or they have a theme, and this one is take the moment. And I think that's what it speaks to what you just asked, is take the moment. If you notice someone that you think is struggling or someone that is acting out of character, they're not being themselves, take that moment to stop, have conversation with him, ask them how they're doing, because sometimes just that contact and showing someone you care can go a long way into helping prevent suicide or encourage someone to reach out for help, for further health and treatment.
Because we could be around people and maybe not know or not suspect, and perhaps all the warning signs were right there in front of us. And is it what's the situation with respect to identifying it early on in the process? Is your prognosis better at that point?
Yeah, absolutely. I mean, with as with any illness, mental illness, physical illness, you want to always identify stuff early on before it gets to a point where it's life-threatening, as in suicide for mental health. And it's just that, again, those subtle changes. I know family is oftentimes the best historian. If you notice that someone is not eating as much, not sleeping as well, starting to isolate, not enjoying things that they once used to enjoy. I mean, we just really need to be looking for those as red flags so that we can, again, have those conversations, let them know that we care, and so it'll prompt them to get help.
When in your practice and in your practical experience, Dr. Pannel, are there any things, I guess, that you see as common causes of perhaps depression or other mental illness or financial problems or marital problems, things like that?
So it's all of that, but there's also a huge genetic component. And if you have a family history of mental illness, you are at risk, increased risk of
Okay.
having mental illness yourself. But also, it's just that kind of that double hit hypothesis. You may have a genetic predisposition, but life is hard. I mean, we have stressors, whether it's financial, um, educational, marital, like we all have stressors, and sometimes it can be overwhelming, and stress can complicate things like anxiety and depression.
And often, I guess, if it goes unchecked, it unfortunately could lead to even suicide, right?
Absolutely. And that's why I like to say that, be mental health aware all year round. Watch your mental health, implement self care. And then in May, let's celebrate the awareness, but always be mental health aware and watch your mental health and protect your mental health.
And our young folks, our young population, that just seems like they often get to a point where they just give up too soon.
Right. And I'm probably a reason, we've kind of become the generation where parents have coddled our kids. I feel like this generation has not really learned the coping skills they need to handle normal everyday life stressors. And so they're reaching out for that instant gratification, that instant fix with pills or marijuana. And that's, I think, why we're in the situation we're in right now, on top of other
Yeah.
stressors like COVID. And so,
Yeah, makes total sense. All right, May is
yeah.
Mental Health Awareness Month, everybody. Dr. Katherine Pannel has been our guest. Thanks for coming on. We'll see you again soon.
Thank
Thanks.
you for having me. I always enjoy being here. Thank you so much.
We did too. Thank you. Coming right back, folks, in the Element Wealth studio.